bringing health information warmly and enjoyably. This is the PillMuse channel. I'm a pharmacist who loves turning complex health topics into something more approachable. And today we're diving into a topic that's surprisingly tricky for many people: alcohol and medications. We've all wondered at some point, can I have a drink if I'm on this medication? Here's the truth. There are some medications where you absolutely must avoid alcohol. And that's what we're going to cover today. For other medications, it's generally a good idea to avoid drinking too. But your local pharmacist can give you the best advice for your situation. So let's go over 6 types of medications that you really want to think twice about before mixing with alcohol. Number 1. Why alcohol and medications can be a dangerous combo. Alcohol affects your liver, your brain, your blood pressure, even your blood sugar. From a medication standpoint, the big deal is this: alcohol changes how drugs are processed in the liver. If you drink regularly, your body may speed up how it metabolizes certain medications. Because alcohol induces enzymes like CYP2E1 or CYP3A4 that can make meds less effective. But if you drink occasionally, alcohol can compete with your meds for those same liver enzymes, slowing drug metabolism, which means you might get stronger effects than expected or even side effects. So no, alcohol doesn't just weaken medications, it can also make them way more intense. Number 2, pain relievers plus alcohol equals liver or stomach risk. Let's start with something simple: pain meds. If you're taking acetaminophen, Tylenol, and also drinking, that's a recipe for liver damage, especially if you're a chronic drinker. Alcohol induces the CYP2E1 enzyme, which turns acetaminophen into a toxic byproduct, NAPQI. Too much of that and your liver gets overwhelmed. And with NSAIDs like Ibuprofen or naproxen, the risk isn't liver damage but stomach ulcers and bleeding. Alcohol irritates the stomach lining too, and together with NSAIDs, it's a double hit, especially on an empty stomach. Number 3, anxiety, sleep, or psychiatric meds plus alcohol equals CNS overload. This one's important. Alcohol is a CNS depressant, and so are medications like benzodiazepines, Xanax, Ativan, Valium, prescription sleep aids like Ambien, even some antidepressants like SSRIs. So when you mix them, the effects stack. You can feel drowsy, confused, lose coordination, even black out. Worst case? Slowed breathing or dangerous sedation, especially with benzos. Pharmacist tip: even 1 or 2 drinks can turn a safe dose into a risky one. If you're on any CNS-acting meds, it's best to avoid alcohol altogether. Or talk to your provider. Number 4, diabetes medications plus alcohol equals blood sugar mayhem. If you have diabetes, alcohol adds another layer of risk. That's because alcohol can lower your blood sugar, especially if you're drinking on an empty stomach. Now, if you're also taking insulin or sulfonylureas like glipizide or glyburide, you can end up with severe hypoglycemia. The tricky part? The symptoms of low blood sugar, like dizziness, sweating, or confusion, can also happen with alcohol. That means you might not recognize you're hypoglycemic because the signs feel like just part of being buzzed. Pharmacist tip: diabetics can still enjoy a drink now and then, but timing, food, and medication all matter. So ask your doctor or pharmacist how to drink safely. Number 5, antibiotics plus alcohol. Not always forbidden, but you may have heard that you can't drink on antibiotics. And while not every antibiotic causes a direct reaction, drinking while on antibiotics is usually a bad idea. Some combinations, like with metronidazole or TMP-SMX, can even cause severe reactions. These antibiotics can all cause a disulfiram-like reaction. What's that? Well, these drugs block the enzyme aldehyde dehydrogenase that breaks down alcohol. This causes a buildup of acetaldehyde, a toxic intermediate, and you end up with flushing, nausea, vomiting, a pounding heart. It's not fun. Other antibiotics like amoxicillin don't directly interact, but alcohol can still weaken your immune system and delay recovery. Pharmacist tip: don't guess. Just ask. Some combos are safe, but if you're on antibiotics, it's smart to avoid alcohol for a few days, especially with the ones I mentioned. Number 6. Blood pressure or heart meds plus alcohol equals fluctuations or falls. Finally, heart medications. Alcohol can interact with beta blockers, ACE inhibitors, diuretics, calcium channel blockers. Some combos can cause blood pressure to drop suddenly, making you dizzy or even pass out. Others can reduce the drug's effectiveness or cause irregular heart rhythms. And if you're drinking heavily over time, your blood pressure may rise, even if you're taking meds for it. Pharmacist tip: for most people, moderate drinking is fine. But check first, especially if you're on multiple heart meds. Let's recap real quick. When alcohol can change how meds are broken down, faster or slower depending on your liver and drinking habits. 2. Pain meds plus alcohol equals liver or stomach damage. 3. CNS meds plus alcohol equals sedation, blackout risk. 4. Diabetes meds plus alcohol equals hard-to-detect hypoglycemia. 5. Some antibiotics plus alcohol equals nausea and toxic reactions. 6. Heart meds plus alcohol equals blood pressure swings, fainting, or rhythm issues. The bottom line? Mixing alcohol with medications generally isn't recommended. And with the types we covered today, it's something you really must avoid. And the safest thing you can do? Ask your pharmacist. We're here to help you drink smarter, stay safer, and feel better. Thanks for watching all the way through. Stay healthy, stay informed, and I'll be back soon with more pharmacist-approved tips and imagery made just for you. You can explore alternate visual versions of this content over on my Patreon. Check the pinned comment for the link. And don't forget to subscribe, like, and turn on the notification bell. It really helps me keep creating high-quality content that supports your health.